Cleft means that there is a failure or a gap in the palate. Our palate is actually the roof of our mouth.
It was in the birthing room, and the midwife said, "Oh, he has a cleft lip." And I didn't even know what a cleft was. I had to ask him.
There's a difference with the cleft being totally unexpected versus those that have been prepared. The ones that we've been able to prepare by having a prenatal consultation, they are already knowledgeable.
I was devastated. Is he going to need a feeding tube? Is he going to need a wheelchair? Is he going to walk? Is he going to talk? I didn't know what Luke and I's lives would entail taking care of him. And my husband was the rock of us, said, "He's fixable, he's so handsome."
And he had 10 fingers and 10 toes, and I didn't even really look at his lip. He's my son.
The first person on our team who would be involved would be our infant feeding specialist.
By 8 a.m. the next morning, the registered nurse from the clinic was by our bedside. She was so warm and loving, and she was there to help answer any questions and concerns that we may have had. "He's healthy, he's beautiful. Look at those blue eyes," she said. And then just made it all better.
Feeding is really the big issue for the newborns with clefts because they can't breastfeed, they can't create suction.
It was trial and error. We had many different systems of feeding. He ate drop by drop by drop, and it was very scary.
Within a week after birth, as soon as the children are home from the hospital, we immediately schedule them to come in here to meet the entire team.
My involvement with the kids here at the clinic is in repairing the lip and the palate, and then we do additional reconstructive work depending on their needs.
At 4 months old, he had his lip closure.
I remember a conversation with Dr. Mackay before the operation, and he said, "I can't promise perfection, but I'll do my best." You know, when he came out of surgery and we got to see him, and Dr. Mackay looked at me and he said, "That's about as close to perfection that we'll get."
And I think we were both speechless, very emotional, and it was like all that reassurance that they told us about, there it was right in front of us.
I have two dreams. I would like to become a professional football player or become a plastic surgeon just like Dr. Mackay, because he helped me a lot and I want to help kids that are just like me.
It's a remarkable position to be in, particularly for a surgeon who very seldom develops a long-term relationship, not just with your patient, but with the family. You're privileged to have this kind of impact on their life.
At various times in a child's life, various team members pop up to the surface.
I had to work on some specific letters.
This is Jesse when he was a bit younger. Now, his cleft was just one-sided, so he had a unilateral cleft.
The letter S and the S sound.
He's already had bone graft done. He's already had his first phase of orthodontics done. So he's slowly getting through the process. He will have an end stage of orthodontic treatment to do, so he can't get away from me quite yet.
I think it's not just about the surgical repair, and that's the part that you see the most, but I think it's the whole picture, which is coordinating the surgery and then speech therapy, getting orthodontic work done, and the dental care, and it's just the whole package.
The treatments for children with clefts are going to not be completed for about 18 years. The average total cost for rehabilitation is somewhere in the ballpark of over $300,000.
I know when we first started going there, they actually were able to help with bills that we've encompassed. I mean, we had a lot.
They're not getting sufficient funds from the state or the insurance companies that can allow us to do this independently.
Private medical insurances traditionally have drawn a line between what is a medical procedure and what is a dental procedure.
So we really need a decent financial buffer to be able to continue doing this for years to come.
If you have a patient who, through no fault of their own, was born with significant differences, is it not appropriate to do everything we could to restore those patients to as close to normal as they should have been had the cleft not occurred?
I like sacking the quarterback. I mean, it's fun, and if you are quick enough, you can get by them without getting pounded.
And to me, to send a child out in a football field like any other parent would send their child out on a football field is the true test of what we do.
We have lots of friends who have adopted cleft children across the country, and they are driving very far to get to their cleft clinic.
All we're trying to do, where we have the care available, is to make sure that families can receive it.
I'm happy we had the surgery so I could be how I am right now, and Dr. Mackay is probably my best friend.
And when you see kids grow up into beautiful young adults, by the time that you finally let them go, it's not just a let's dismiss this patient. It's really almost someone leaving home.